As usual, it's a pleasure being a part of any meeting where Dr. Ashok Das is associated with the meeting. And we had some elegant talks in the last hour, 30, 40 minutes. Now, in the next 15 minutes, we'll be talking about the relevance of gut microbiota in type 2 diabetes mellitus and whatever is the data available today. If you just look at this one slide, gut harbors a huge number of organisms, viruses, fungi, bacteria, and whatnot. But most studied happen to be bacteria. And a rough estimate tells us there are 100 trillion bacteria harbored in our gut. And you can imagine how many fold the genome they must be having in comparison to a human genome. And they have evolved over millennia and have a survival value. We provide them boarding and lodging, and they provide us some survival values, which we'll be talking about in the next 10, 15 minutes. This one review data that was recently published in Microbiology and Molecular Biology reviews. And if you look at it, in utero, the bacterial gut is sterile. And as the delivery occurs, through the nares, the oral mucosa, the cutaneous region, the gastrointestinal tract, the body starts getting impacted by the different organisms. The common ones which are harbored in the gut are actinobacteria, Bacteroides, Firmicutes, Fucibacteria, and Proteobacteria. And by the age of 4 years, at the time of birth, totally sterile gut, then right from the birth, the gut starts getting colonized. By the age of 4 years, the gut microbiota hosts all the organisms that a mature individual would have. And this would not change for the next 7, 8 decades, if not interfered with by different agents which have a possibility of impacting the bacterial flora, particularly the antibiotics that we use so often. What does this gut microbiota do? It plays a structural role. If you look at the mucosa, it has a role in maintaining the structural architecture of mucosa. It seems to regulate the gut permeability. And if you look at it from the functional point of view, one important thing is many of these normal commensals prevent the pathogenic organisms to occupy the gut. Metabolic components helps in synthesizing many substances, including some of the essential amino acids, short-chain fatty acids, and absorption of many of the substances that otherwise would be difficult to absorb. What do we mean by dysbiosis? All these million bacteria, different species that harbor the gut and have a value in keeping us healthy and themselves survive. If this relationship is disturbed, if there's interruption of this healthy symbiotic relationship between the human host and the gut microbes, this results in a state known as dysbiosis, which some of the recent data has shown is associated with obesity and understandably the consequences of the obesity, including type 2 diabetes mellitus, non-alcoholic fatty liver disease, cardiovascular disease, and some malignancies. When I reviewed the literature, there are many conflicting reports regarding the overall microbial diversity in people with diabetes. But however, majority of studies have reported relative differences in specific microbial species, decrease in bacteroides and increase in Firmicutes in many patients with type 2 diabetes in few small human studies. Decrease in butyrate producing bacteria in patients with diabetes. But what are some of the basic things that have become clear over these decades, ever since people have started developing interest in understanding the gut microbes vis-a-vis diabetes. The role of some of the bacterial products which are pathogenic in origin, altering the gut permeability. If you look at one such product, circulating lipopolysaccharide, which happens to be a part of the component of the gram-negative cell wall, there's some data available that has been shown that it increases the permeability of the gut and it goes in. There is limited data to suggest that this circulating liposaccharide levels are high in patients with diabetes. And this, when it goes into circulation, has a potential of causing insulin resistance. Huge review on my gut microbiota and gestational diabetes. And no, just look at it. The mucosa. Look at on the extreme left, those tight junctions. And some of those bacterial products from pathogens have the potential of breaking those junctions and making it more permeable. And from different organisms, a lot of molecules have been identified apart from LPS, known as pathobionts, zonulin 1, zonulin 2, alkaline, which impact the permeability of this gut and cross the mucosa, cross the submucosa, and cause what is known as metabolic endotoxemia once they get into the circulation. And once they are into the circulation and you have this metabolic endotoxemia, then these metabolites, thus pathological chemical entities, they impact macrophages, they impact T cells. But more importantly, if you look at the bottom line, they have the potential of impacting adipocyte tissue, hepatic tissue, and skeletal tissue. Why do you know? They can cause increase in interleukin B, interleukin 6, TNF alpha, many of the markers of inflammation. So thereby connecting, you have this dysbiosis, you have this metabolic endotoxemia, which many of these molecules do impact different tissues in the body and cause an elevation of certain substances that indicate inflammation. Summarizing this, people who have genetic potential, bad diet, or injurious antibiotics, dysbiosis, go within the circulation, metabolic endotoxemia, impact adipocytes and other tissues, as I showed, causing a pro-inflammatory state. There's a break in the gut barrier, and this endotoxemia associated with increased inflammation and ultimately insulin resistance. Gut microbiota plays a central role in a metabolic endotoxemia model. This model that is proposed of obesity and insulin resistance. Diet is high in fat and low in fiber, alter the function and composition of this gut microbiota. There are quite few studies, rather limited but available, which have shown that therapeutic interventions that can alter the composition of this gut bacteria. Dietary mechanizations, prebiotics and probiotics. Understandably, antibiotics do either way. Fecal transplantation and bariatric surgery. And surprisingly, we know that metformin has been discovered more than a century back. Its use was initiated in 1960, started with Britain, France, then taken over by most of the Asian countries, but then stopped from use because of the potentiality of causing so-called lactic acidosis. But amazing data has shown that this molecule, which has so many benefits, which we have known now over the last 2-3 decades, has also some role in maintaining the gut microbiota. Obese type 2 diabetic adults placed on either a fat or carbohydrate restricted diet seem to be changing their gut flora in such a way which, as I alluded to, more bacteroids and less firmicutes. And otherwise also, as I showed you, few papers have shown that people with type 2 diabetes have the reversal of this, which we usually find out. And this also has been shown not only with the high fiber diet, if a person takes more of vegetables and fruits and fermented food like yogurt. With this realization, now people have also been considering gut microbiota in the mechanizing the gut microbiota in the treatment of type 2 diabetes mellitus. A lot of reviews have recently been published, and understandably, a duration of 10-15 minutes would not do justice to it. The relationship between the gut microbes and metformin as a key for treating type 2 diabetes mellitus. You can imagine, many models have been discussed how metformin can impact the gut microbiota and impact diabetes control. These are the different, in various in vitro and vivo studies demonstrated that metformin might exhibit glucose modulating effects by interacting with the gut microbes. Each box presents a putative mechanism suggested in this particular review that I'm alluding to. And in summary, what does it say? Look on your left side, the metabolic syndrome. You have microbiota dysbiosis, increase in those pathobionts that I talked about, impacts the gut permeability, bacterial encroachment, which ultimately results in the bacterial endotoxemia, impacts the adipocytes, hepatocytes, myocytes, creates a pro-inflammatory state, a low-grade inflammation, insulin resistance, and type 2 diabetes mellitus. And understandably, the potential microbiota-based treatments would be helping in reversing this whole sequence, right from trying to normalize the gut microbiota, putting a seal on this production of abnormal pathobionts, and restoring the gut permeability, and slowly and steadily, possibly reversing the rest of the things. I was really amazed looking at this review article showing the role of gut microbes and the onset and progression of microvascular complications. They refer a whole number of mechanisms, many of those proteins, biochemical products from these bacterial cells, walls or the nuclear material, which when they go into the intravascular compartment, have the potential of either initiating, but more important, aggravating some of the complications of diabetes, particularly a huge amount of data published in nephropathy. And in the animal, in the comparative endocrinology, quite few papers published not impacting the renin-angiotensin system, the nephron as such, the glomerulus. From therapeutic point of view, most prebiotics are oligots which travel the upper GI system, and they have been shown to play a positive role. So have the probiotics. Probiotics are live bacteria and yeasts which bring about specific changes in the composition of these gut microbes and have been shown to help in normalizing the gut. I could find out few randomized control trials, but rather limited to find out whether intervening would be helping the management of diabetes. These findings imply the need for well-designed clinical studies rather than these few random 5-6 patient design studies. Understandably, antibiotics, when a pathogen impacts and does occupy the gut, taking care of that by the antibiotics and giving an opportunity to normal commensals to come back in the quantum that they normally are used to is relevant. Yes, a huge amount of data published. Fecal transplants from normal people, from non-obese people via gastroduodenal tube into the obese people who have metabolic syndrome. Published data shows that this intervention improves insulin sensitivity, thereby proving that whatever factors were responsible for worsening the insulin sensitivity stand reversed. So another way of looking at it in years to come. Bariatric surgery has been shown to lead many important physiological alterations, including both short and long-term change in gut microbiota composition. Whether it helps in normalizing it in some way, again, needs to be understood in a more intense way. So in conclusion, there's mounting evidence, mostly from the animal world, and a few from human studies that support that gut microbiota can influence host health and disease. And people with type 2 diabetes have altered gut microbiota. And modulation of this gut microbiota composition and function has the capacity to alter the host metabolic profile in a desirable fashion and needs to be better studied and understood. Thank you so much.